It's really important to get the care you need. There's a significant number of people who've waited and are fearful of COVID and heart attacks, cancer care, wellness care. All these things can lead to bad outcomes. And the risk of COVID is very low. The number of people that actually are testing positive, even for those who have symptoms, is a single digits. So if 10 people come in thinking they have COVID, less than one of them is going to actually have it. So the risk of getting COVID is there. It's present just like anything else. But the risk of having a heart attack, the risk of your shoulder getting worse, the risk of a laceration not healing well, the risk of your sinus infection becoming worse are all present and should get taken care of. We're trying to limit the number of patients just like everywhere else. So we have a system called Solve. You can get through UH's website and it allows you to get a call ahead seating type situation. Next thing is everybody wears a mask, the staff, the providers, and we give the patients masks when they walk in. There's a screening at the door. They take the patient's temperature. We're still going to treat you if you're ill and have a fever, but at least it tells us who you are. Then we ask them a series of questions to help get an idea of their risk of having COVID or other illnesses. And we, as quickly as possible, take you out of the waiting room, which we try not to have people in very often, but we also frequently clean the waiting room. The waiting room has less furniture than it used to have. We've spread everything 6 foot apart. We've taken out magazines. We've taken out other items that could not be cleaned. We're cleaning it frequently, and every night the entire centers are cleaned completely, aggressively, to make sure things are what they should be. Patients are whisked back to a room quickly. We use the appropriate PPE. We keep our distancing when we can. We're using our mask, they're wearing their mask. We're seeing them, we're taking care of them, and then we're getting them on their way. Once they leave, we deep clean the rooms, and we make sure that everything's safe for the next time in. To take even greater precautions, we've set up multiple what we call fever clinics. This is where we take care of COVID positive patients either from the community, from the hospital stay, or who think they may have COVID. We've moved them out of our regular urgent cares so that we can even create greater separation. We've always been good about this, but now we think about it constantly. We're just as concerned about getting the illness as you are. So I don't want to get COVID, the staff doesn't want to get COVID, we don't want the patients to get COVID, so we're all taking those precautions. I have a wife and 5 kids at home, one of them with significant disabilities. If I wasn't comfortable coming home after working, I wouldn't be comfortable having you come in. But I need to take care of me, I need to take care of you, and I need to take care of my family. And that's why it's very important in all of our minds that we keep our wits about us about infection control.